Hello, my name is Wakiro Sato. I'm from Tokyo, Japan, and I'm a neurologist. And this time I attend this conference because I represent our clinical trial study using rituximab for ME/CFS patient. Yes, so as a neuroimmunologist, we apply the brain MRI imaging study combined with anti-autonomic nerve receptor antibodies, and we found that there is a connection or link between the brain abnormalities detected by a special MRI technique and antibody titers. So this means immunological abnormalities and brain abnormalities are connected. Yes, and if this is so far, this finding is just from our institute, but if this is replicated, and also if this is validated by another cohort, then we can use this as a diagnostic marker. And also, if this is used as a diagnostic marker, then you can apply this for the clinical trial. And so the development of drug is also promoted by this finding, I hope so. Okay, so it is a brain MRI imaging, but different from a normal T1 or T2 imaging. We apply the DKI study, diffusion Cathotic imaging, and this technique can statistically find out subtle structural abnormalities in some part of the brain. And so far, we cannot tell from each patient basis the imaging is abnormal or not. We just distinguish on a group basis. That's the limitation for now. Okay, so neuroinflammation is still difficult to detect in a clinical setting like MRI or other techniques. But people think PET imaging, PET imaging can detect neuroinflammation of glial cells such as microglia, and Japanese group, different Japanese group suggest that there is uptake of PET imaging in the brainstem or in the central part of the brain in ME/CFS patient. Yeah, suggesting neuroinflammation detected by PET is a promising imaging technique, I think. Yes, now many neurological diseases, including multiple sclerosis or Alzheimer's diseases, they are all connected by a concept of neuroinflammation. So in this sense, ME/CFS is one of the group of diseases with neuroinflammation. So as WHO designated ME/CFS as a neurological diseases, we believe this is a correct nomenclature. So first of all, we have to sophisticate the method to improve the resolution, for example, and really we would like to detect abnormality in single patient. So far, it's technically difficult, but this is one achievement we want to make. And another is, as I said, PET imaging is promising, but still in clinical setting, it's not applicable in usual clinical setting. So we need more study. Yeah, but at the same time, because we are started clinical trials, we can compare the pre-treatment data and after treatment data, and what kind of change we can observe. Then we learn which part of the brain or which marker, which imaging method is suitable to detect the treatment effect, and also the these results will show us the pathophysiology of the diseases, we believe.